good morning, and thank you for doing this. I was kind of looking through your story. It's very interesting, to say the least. Tell us a little bit about your background, if you don't mind.
Yeah, so I'm 45 years old. I have 4 kids. I'm a nurse at a long-term care and rehab facility here in Pocatello, Idaho. And I am big into fitness and health, and I'm obsessed with health, and I've been sick all my life. So I'm doing great now, and I'm excited to talk about it.
Well, very good. And it's the sad thing is there's when you look into healthcare, and I spent a long time in healthcare, you don't see that many people that are actually healthy in healthcare. They're mostly sick. It seems like, you see, I remember working in Galveston, Texas, doing my residency, and then we joked that the nurses had a retirement plan. They either got to 20 years or 300 pounds, whichever came first. They got to retire, and it seemed like many of them were trying to get the 300-pound route. But anyway, so you said you're a long-term care nurse in Idaho, and it looks like you just had just a whole slew of various autoimmune issues. You want to kind of tell us a little about that?
Yeah, so I was raised on the standard American diet: Cheetos, white bread, Kraft singles, left to my own device a lot of the times, and I just ate what I wanted. And I was in and out of the hospital as a child with terrible, what we thought was hip pain, but it was ankylosing spondylitis, and they would put me in traction and send me home and called it irritable left hip syndrome. They didn't have any idea why it was happening. And it kind of came and went throughout my adulthood, and was in remission for a full 14 years until I got COVID. And then everything went to hell in a handbasket after COVID, and full-blown RA, full-blown AS, both, of which my rheumatologist told me there's no way I could have both of those diseases together. He said he's never seen it. But sure enough, after he did all the testing, he had to call me and apologize and ask me to start Humira along with the methotrexate I had already been on for a year and a half. And it's still in my fridge. I haven't started it. I don't plan on starting it. I've been off the methotrexate now for 7 weeks. And I was on the highest dose weekly, once a week. And I've been off that, and I'm doing great.
Yeah, I mean, for people that aren't familiar, ankylosing spondylitis, a lot of people are familiar with RA, rheumatoid arthritis, but ankylosing spondylitis affects the axial skeleton, the spine, the neck, the pelvis, and can lead to frail bone, chronic irritation, inflammation, all those types of things. And I've seen quite a few people now with ankylosing spondylitis get better, which is kind of cool. And then you said you had some eye issues as well. What was going on with the eyes?
Yeah. So those two autoimmune diseases, they basically cause you to have the worst dry eye ever. I have no lubrication in my eyes. And so it's called SPK. And I can't even fully pronounce it every time. I need to look it up every single time I talk about it. But it's virtually just damage done from no lubrication in the eye. And it can lead to all sorts of yucky things like blindness in the future. And that has yet to really improve with Carnivore. That's the one thing that has not fully, I don't feel like I'm there yet. I feel like it needs more time, and I'm hopeful, because if that's all I have to deal with right now, I can handle that. I'm on medication for that, the eye drops, and I'm doing other different modalities like radio frequency and other things to just, try and help that along. But the biggest thing is I'm in remission from both of those diseases, and I was in bad shape. I had every single symptom textbook of ankylosing spondylitis, every single one from head to toe. And it was ruining my life. So I responded quickly when I implemented Carnivore.
Yeah, interesting. So superficial punctate keratitis.
Yes.
SPK, and so I guess it's a issue with the cornea itself. So the outside layer of your eye is being damaged. So, and so let's talk a little bit, because methotrexate is not a nice drug to be on. Can you talk about what some of the downsides of methotrexate are?
Yeah. So oh my goodness. So I would take that once a week, and it took me a couple of days to feel normal again after I would be, dosing that. I would get mouth sores, and just feeling like kind of out of body, not fully in my body for a few days. It's the weirdest sensation, but it's not good. And just feeling just not good. But it never made me sick. I never got really sick with it as far as like GI distress or anything. It was mostly lots of mouth sores, and they would just heal up and it was time to dose again. So it was not fun.
Yeah. Now you said, you had this, since you were a kid, with the hip issues, and they finally figured out it was ankylosing spondylitis. And you said it went into remission for a number of years. And then you've been into, obviously taking care of yourself, lifting and doing some, I guess, some bodybuilding.
Yes.
How did you sort of put it into remission prior to catching, I guess, COVID?
I cut out wheat. This was years and years and years ago in my 20s, when I was having babies and having the worst flare-ups of my life. And I cut out gluten and dairy, except for eggs. I kept eggs, and it went into full remission for 14 years. I forgot about it. I didn't even, I forgot about it. I didn't identify with it anymore. And after COVID, it started creeping back up on me, and it was devastating because like I said, I thought it was gone. But before starting carnivore, I was eating fruit, lots of vegetables, organic nuts, everything organic. I was eating the organic junk food too, every once in a while, like organic popcorn and, organic keto crackers, the junk food. But I was making it the highest quality junk food. That's how I justified it.
Yeah, it's kind of interesting. It's still junk food,
It's total junk.
I talked to the other day. I was kind of having this sort of, and I'd mentioned this for years ago. We have a lot of people using CGMs right now, and they're actually out there sitting there, and they're testing their blood glucose after eating certain junk food. And they're like, well, this junk food doesn't make my blood glucose go up so high. So it's obviously good junk food. It's still junk food. It's just causing different issues, most likely.
Right.
You said all of the symptoms of ankylosing spondylitis. What were those symptoms for you?
Oh my goodness. I had inflammation in my heels. It was hard to walk with barefoot, very painful actually. And these all would come and go and intertwine. And, one day something would hurt and the next day that would be gone and it would be something else. So heel pain, lots of SI joint pain, lower back stiffness. Like I felt like I had a steel rod in my back for hours after I would wake up. It would take a long time to loosen that up. Sternum pain, neck pain and stiffness. That's new. The absolute worst is the pubic bone pain. And that was a pain that I had never, ever had before until after COVID. That was new. And putting weight on either leg when your pubic bone is inflamed is excruciating. And I would go to work and walk up and down those halls and just hold on to the rail. And, it was awful. When I was pregnant, my OB doctor offered me a walker. I was 22 at the time, and he had nothing for me but pain pills and a walker. He wasn't even really interested in figuring out what it was.
Yeah, I mean, some women during pregnancy, they'll have a pubic diastasis where things will separate a little bit because you produce a hormone called relaxin, which helps you to allows you to pass a kid. Humans have relatively small pelvises relative to our babies' heads, and so that helps us to do that. And so some women end up with a kind of a pulled apart pubic bone, and that can be. I've seen this, but that's very painful. Sometimes I would get them as an orthopedic surgeon, and we don't really have an operation for that. And quite honestly, you don't. Most people aren't going to talk about diet; they just don't know. You work in long care facility. I mean, how much do you see that? Because you have these people that are if they're in long-term care, they usually got a lot of bad things going on. Much of that can be lifestyle related. Do you see what does their diet look like when you take care of those folks?
I got to be careful here because it's my workplace, but it's not great. It's not great at all. Not very much meat. It's what is everywhere. It's what everyone's eating when they're in a skilled nursing facility.
Yeah. The hospital food certainly lacks a lot, and it's just pretty much just the same old junk food that probably put them in there in the first place.
Yeah.
Um, as someone who works in healthcare as a nurse, do you are you able to share what you're doing as far as what's getting you healthier with people around you?
Oh yeah. They all know. All my coworkers know. Everybody knows. I think a few of them are taking it and watching and, paying attention to my posts when I share things on social media. And, I'm impacting a few people here and there, but for the most part, I don't get too intense at work. I don't want to really cross any lines there. And I just want them just watch and see. And, maybe it'll help one of them in the future if they're ready and open, but I don't push too hard at work. Yeah.
Yeah, that's probably some of the best thing you can just demonstrate results, consistent
Yeah.
results over time, and then people sort of, eventually will come around to that because everybody, you know, given enough time, will get sick if they continue on the path of just
Yep.
standard junk diets.
Yep.
Did you ever like? Did you ever go fully like plant based? Was that ever part of your?
I tried it for like a month. It was terrible. It was awful. Not that I ate a lot of animal products to begin with, but fully cutting them out just made me. It was too restrictive. I didn't enjoy it. I didn't feel good. I wasn't feeling good, so I had no desire to continue doing it, and it didn't feel right. It didn't feel right. I do have family members who are vegan. So.
Yeah, I do consultations every day still, and I at least several times a week I get someone who is on a plant-based or vegan diet, and their health just went very, very badly, and so there's something going on with that. It's certainly not optimal for most people for sure. Maybe a few people can do okay on that, but now you mentioned so you caught COVID from work, or how did that happen? And tell us about how that happened. And when did you start seeing these flare-ups with the RA and the?
Yeah, I got COVID at work, and it wasn't for a few months after that I went on a trip to Washington, and my hand blew up to the point where I had to put braces on my fingers to keep them straight, and it was devastating. Each day I woke up on this trip, my hand was larger and larger and larger, and it was completely deformed. I couldn't use it at all, and I was in pain. And that was my first rheumatoid flare. My dad had rheumatoid. He was crippled with rheumatoid. So I thought, I'm 45. I haven't had it yet. Maybe I'll just have the AS. Maybe that's just the only one that I'm going to get, with these crappy genes. And sure enough, full-blown RA after that COVID infection, and started methotrexate and prednisone right away, like within a few days. And it saved me. The drugs do work, but then there's a trade-off. And then after the second COVID infection, so I had COVID twice. So the first one gave me RA. The second one gave me a recurrence of the AS. And it wasn't as severe as the flare-ups I've had in the past, where I was in bed and could not walk. But it was enough to make me limp and just be in constant pain.
Yeah, so you certainly see an inflammatory. I've got Katie here commenting that she's seen a lot of people with RA flare-ups, severe, post COVID infection, and they're taking, high, IV dose, high dose IV immune modifiers. The Humira you had, when you ordered that, do you remember how much it cost? Do you remember how much it was costing?
It cost me $5.
Right. But as far as
it cost my insurance, I think I don't even know. Yeah. I don't even know how much my insurance paid for it, but they have it now so that anyone can get it for $5.
Yeah.
All you have to do is sign up for their program, and they make it so that it's $5.
Yeah, the insurance company's not paying that for that. I can guarantee that. But interesting. So you never had to take it, correct?
I've never taken it.
Yeah.
It never ever felt right.
So how did you go from eating lots of vegetables? What drove you towards trying a carnivore diet?
Well, like I said, I was miserable. I was in bad shape, psychologically, emotionally, mentally, physically, everything was falling apart. And I just started researching and autoimmunity, and it just led me to carnivore. And I started with Nutrition with Judy, listened to all of her podcast episodes, and it just snowballed from there. And when I implemented it, I needed to know everything about it and how to do it correctly. I didn't want to have any mishaps along the way. I didn't want to have any setbacks. So I researched for so many hours a day and listened for so many hours a day, not even listening to music, just constant educating myself on this. And then I decided to implement it. And once I did, I turned a corner so quick, and I've had many good days now, all in a row.
How long ago has that been now?
Like 3 months.
Okay. So it's been pretty rapidly. And so when you said you started, so how did you do? What did you start eating?
I started eating steak every single day, and, cooking it the best way that I could. I don't cook a lot of meat, so I'm not experienced there. So I a lot of ground beef. Careful with the eggs and the pork. If I can find soy and corn free, then I'll eat those. But mostly just eating beef and butter, focusing on beef and butter, and eliminating all of the crap. Mm-hmm. Okay. It is exactly what my body needed. It healed fast.
Were you much of a beef or a steak person prior to this?
No. Every once in a while when I would crave it, I would have it. But other than that, I did not eat a lot of meat.
Have you noticed any sort of, outside of the AS and rheumatoid flare-ups, any other improvements in, quality of life, mental health, physical?
100%. 100%. I used to be in bed at like 5 p.m. and now I'm up till 10. I'm up till as late as I want to be. I'm not dying of exhaustion like I used to be. My workouts have improved. I have put on muscle, dense, beautiful muscle, where I was at a 2-year plateau, eating the way that I was eating and being so inflamed. I was just maintaining, like busting my ass just to maintain. And since going carnivore, I've been able to build this muscle that is it's more dense than any muscle I've ever had before. And I'm leaner than I've ever been. I've always been lean, but I'm leaner, and I do exceptionally high fat. I crave the fat, and the more fat I eat, Shawn, the leaner I get. It's crazy.
So so just out of curiosity, how much fat are you eating typically, and how much protein, how much do you eat a day? Let's describe what you're eating in a day.
So I don't count anything, but I can just tell you what I eat. So I eat a steak every day. I spoil myself. My favorite food is ribeye. I eat a ribeye almost every single day. And that makes me so incredibly full. I also have it with butter. And I'm so incredibly full after that. And then I wait a few hours, and then I have ground beef patties, as many as I can eat with butter.
Okay. So, and the size of the ribeye is what? Is that a full 1 pound ribeye, or what do you think?
14 to 16 ounce, sometimes larger. When I went on a girls' trip recently, I ate a 40 ounce tomahawk. I did.
Nice job.
I really did.
Good. Well, but I mean, I'm just listening, like I'm trying to figure out proteins there. You're, a 1 pound ribeye is it's close to 100 grams of protein plus some burger patties. So you're probably 150 grams a day, something like that. I bet it's more than a pound probably more than a gram per body weight. I don't know what you weigh, but I'm guessing you're under 150. But so that's a decent amount of protein and fat on top of that. So you're getting the fat from the meat, and then additionally some butter. Basically, that's your fat source.
And some days I'll do less butter. It's just I'm doing it just based on how I feel and what I'm drawn to that day. So I guess it's more intuitive. I'm not counting. I'm not measuring anything.
Yeah, I'm just, and that's fine. I'm just, I'm just predicting, with ribeyes, a little bit of butter, you're probably eating, 70% of your calories are coming from fat, which is,
Yeah.
definitely a high fat diet. There's no doubt
Yep.
about it.
And that's where I feel the best.
Yeah. Yeah. Likewise, that's similar to what I eat. I mean, very similar. I usually eat maybe somewhere in that range typically. And then you said your performance has been better in the gym. You've gotten stronger.
Oh
Uh,
yeah.
some people say that they just feel flat on a carnivore diet. They can't work out. They can't go intense. That's not been your experience, though.
No, I am able to work out longer, harder. Everything is improved. Everything is improved.
Do you, so at work, and I don't know what kind of shifts you work. I mean, if it's 12s or 8s or whatever.
12s.
12.
Yeah.
So, I mean, are you eating at work and are you having the difficulty? You bring your own food in? Do they have stuff that you can get that's?
No, I bring my own food. Yeah.
So, and then do you eat with all the other nurses or other medical staff and they go with
Yeah.
you just eating another steak again, huh?
Yep. I get lots of weird looks and it's okay. They're like I said, they're all super supportive of me, super kind people. And they're watching me. They are.
Yeah. You had mentioned you had some family members that were on a plant-based or vegan diet. Because you've been at 3 months and maybe it's not been long enough for them to really see a difference or interact with you much. But has there been any sort of "you're crazy, you're going to kill yourself" type of comments coming in?
Yeah. And I have to be careful here too, as well. I have 3 family members who are vegan, and the 2 that are doing really well on vegan, from what I have observed, they have cheat days with meat. So I think they're doing better because of that. And I think that they would be a lot sicker if they weren't doing that.
Yeah, the so-called Chegan or something like that. It's kind of an interesting phenomenon that I think most people that do a vegan diet end up sort of supplementing with meat from time to time, and kind of maybe what's keeping them safe on that. You said you had 4 children. Are they how old are they? Are they still in the home? Or are they?
I have 1 at home. I have 3 adult children and 1 still at home, and he is big time carnivore-ish. He's doing great. He's doing great.
Yeah, I mean, a teenage boy, would probably be pretty happy to crush a bunch of steaks, all the
and
time.
Bacon and butter. And I cook him a steak every day. He's got it made. Big time. But, he's also been the one that's watched me here at home. It's just the 2 of us. Right. He's watched me, go from crying all the time, limping, and just being sad and in pain. He's watched me go from that to this. And he knows that he's got autoimmune genes somewhere inside there. And I've taught him, hey, if you want to keep those dormant, you have to do this.
Yeah. Yeah. Well, it's interesting, Idaho is probably among the states out there, like I said, I'm in Washington State, kind of not far from Seattle, and then I'm in California, which definitely has more of a plant-based, sort of acceptance here, or even almost, people almost have an expectation for that. Idaho is still relatively, I don't know about Pocatello, I've never been, I'm in Boise and some other places, but do you find that it's eating meat there is no problem?
Yeah, it's no problem.
Yeah, it's a good place to be.
Yeah.
What other things? I mean, are obviously you're lifting or you're training. What other things do you feel are important for your overall health?
My mental state, my emotional state. I am extremely, extremely anxious on a normal basis, and that has improved greatly with this diet. I'm just more calm. And I have a calm gut for the first time in my entire life. That's another thing. I have been dealing with IBS-C for my entire life, which I even had. This is so gross, but we're just going to go there. I had a rectal prolapse in my 20s after my 3 babies, and I had to go to a specialist. Nobody around here would even come close to me because I was so young. And went to a specialist, and I asked him, I'm like, why is this happening to me? And he just said, well, you just have poor collagen, I guess. You're not the youngest that I've seen this in, but it's got to be poor collagen. And I had surgery. I had to have abdominal surgery to fix that. It was awful, absolutely awful. So I've had gut issues my entire life, and I have the most calm gut. That's the best part, honestly. I have to say that's the best part. Even after eating a massive amount of meat, my stomach is still nice and flat. I'm not bloated. I don't feel like crap. I don't need to lay down. I can get up and keep going. And I don't know, it's been just a miracle for me all the way around. There's nothing that my skin is better than it's ever been. I used to have, every week I would dig all the plugs out of my pores in my nose. I have oily skin a little bit. And so every week I would clean that shit out, and there's nothing there anymore. My pores are completely empty, and that blows me away. I've been doing that my entire life. So that's another benefit. It's the skin, the hair, the nails. I am supplementing with desiccated organs because I cannot eat organ meat. Just can't do it.
Yeah, I don't eat them at all. I don't supplement any of that stuff.
Is that right?
I don't know that it's necessary, quite honestly. That's not been what I've seen. There was somebody commenting on your hair. They said, "Hey, have you always had great hair, or have you seen your hair quality has improved?"
My hair quality has improved big time. Oh yeah. My skin, everything.
Yeah, the gut is kind of an interesting thing, and there's I think a lot of relationship between the gut and autoimmune disease.
Yes.
And seeing that your gut is calm, and then the IBS-C subtype, which is primarily constipation, that's gone away. That's better, and some people, because a lot of people say, well, if you only eat meat, you're going to have problems going to the bathroom, and that's not been my experience or what I've seen for the majority of people. So that's I can eat a big steak and go work out right after, and it doesn't bother me. Something that I do. How do you? I mean, what about you do with like things like electrolytes? Do you have any issues with electrolytes? Are you supplementing those?
I am supplementing those every other day so that I don't accidentally overdo it. I use Remite. It's got a little bit of iodine in it, and I feel great. I feel great doing that every other day. I have noticed if I do it every day, I will get a little bit of a headache. So every other day works for me. I do salt water for my pre-workout. I am completely off caffeine and just some salt water. And I have a massive, massive pump at the gym, and my veins are like exploding out of my arms. And it's salt is, I moderate salt quite a bit during the day. I don't do light. I don't sprinkle it. I go kind of heavy. I'm checking my labs frequently. I'm due to get them checked again. My hemoglobin A1C before I started Carnivore was 6 point something. Yeah. I was upset about that. I was like, are you kidding me? But I was eating a ton of fruit all the time. And I even checked my blood sugar after eating a massive amount of watermelon, and it barely even went up a little bit. So I had that frame of mind. It's not hurting me. My blood sugar is fine, but it was making me almost insulin resistant a little bit. So my hemoglobin A1C is down to 5, like in the low 5s now. My fasting insulin is 3 after eating this way. Like I said, I'm due to have my blood work checked again. All my hormones are optimized. I had a hysterectomy years and years and years ago. So I am on bioidenticals, and I take DHEA, and I've always struggled getting my testosterone where I want it. I like it just a little bit high, on the higher end of normal. And since going carnivore, it just went right there all by itself. So everything just has lined up, and I feel amazing. And I have not had one setback, one setback.
That's awesome. Yeah. There's a few studies out there that support higher cholesterol in the diet leads to higher testosterone in both men and women, which would make sense, when it's made. But I want to ask you, so you said you gave up caffeine. So were you a coffee drinker prior to this, and then you decided to
every once in a while I would have a coffee here and there? Yeah.
Did you have?
What's that?
Did you notice an improvement by giving up caffeine? Was it helpful for you?
I'm less anxious. I think that's a big part of it. I have experimented a few times since going carnivore with an occasional coffee, and I feel like shit. Like my heart starts racing, and I feel anxious for no reason. And So I do love the flavor of coffee. So if in the future I really want that, I'm going to do decaf and just to get that taste, because it is kind of a treat because I love the flavor so much. But for the most part, I have no problems not having it. I have no problems not having anything. I have no desire to eat anything else. I was just talking to my boyfriend last night about this. He's like, do you plan on introducing fruit? And, because he follows Paul, and, Paul talks about fruit and honey. And he's like, do you think you could, reintroduce those things? And I'm like, I have no desire to. I just don't want to. What are your thoughts on that?
Well, my thoughts are it's unnecessary. I don't think you have to. I think people that tell you must eat sugar to, for your metabolism to work, or it's going to lead to hypercortisolemia. It doesn't really happen, at least not long term. If you want to, it's fine. I don't tell people not to do it, but I don't think it's necessary. And if you don't feel like you need it, and you don't do it, I don't consume it. I haven't for years, and I function very well. Very very at a high level. I don't need it for my workouts. I don't feel like I need it for any real particular reason. So yeah, I'm I always sort of a little bit skeptical when someone says you must do this or that to be optimal. Same thing with the organ meats. That's just not what the data shows. The data out there that I've got on 12,000 people, the data from Harvard University shows people eat organ meats versus don't eat organ meats. There's no difference in outcomes. And so I think there's a lot of marketing and conflict of interest, unfortunately, that's being pushed with that stuff. So, but anyway, that's my perspective and what I've seen. It's just based on data. I don't really care one way or the other. So you do what works for you. Is your boyfriend? So he probably likes steak too, then I imagine.
Mm-hmm. Yep. He loves it. He's watched me heal, and he's fascinated by it. He's doing carnivore-ish with me. And I think I can get him to be full carnivore eventually.
Well, whatever works for him. I don't know.
Yeah.
Push, but I mean, if he's,
Yeah, but no, he's very supportive and very, very on board.
Yeah. So you mentioned you eat your labs all the time. You mentioned your A1C went down. Any problems? I mean, one thing, obviously people say, well, what about your cholesterol? What happened with that? Is that something you're concerned about?
I'm not concerned about it at all. Like I said, I'm due to have my labs checked now, so I'll probably get that done here in the next few days. But I'm not worried. I've educated myself enough to know that some numbers are going to go up, and I'm just going to go based on how I feel, and I'm just not going to worry about it.
Yeah, I think there's a lot of that makes sense to me. As far as if your all these inflammatory issues are going away, and we know that inflammation also drives cardiovascular disease. And so if we see a dramatic reduction in inflammatory markers, or for you, it's very nice because it's a double-edged sword. Like when you do the wrong thing, you pay for it, right away. Whereas other people, it may take years, and they're just slowly, destroying their blood vessels, and they don't even know. But you get that immediate feedback that, hey, this is not good for me. Do you find what else is there going to say there? So you're eating a decent amount of protein, decent amount of fat. How often do you eat? Twice a day, typically? Is that pretty common?
I intermittent fast. I've been doing intermittent fasting since 2013, and I'm still doing it with carnivore and having absolutely no problems. I work out fasted. So I don't eat until the evening, and I eat 2 meals.
Okay.
And sometimes I worry that I'm not eating enough. Sometimes I worry that it's not enough. And that's why I feel like I need to supplement with the organs. I don't know. I need to think more about that.
Well, I mean, ultimately you do what works for you. Like I said, the desiccated organs aren't going to provide a significant amount of calories for sure. I mean, it's,
No, but the nutrition is there.
Yeah. Sure.
Right. Yeah.
So, just to a degree. Yeah. Do you, what about, so you're working 12, so you were doing like 3 12s a week, or what is your?
I actually am down to 1 day a week of work because of these diseases.
Okay.
And I've gotten better, since then, but I'm just going to stick with that for now. I just do 1 day a week.
Okay.
And honestly, my hands couldn't handle more than that. And my eyes, I was worried that I wasn't going to be able to work at all.
Yeah.
So I did get down to 1 day a week, and I've just stayed there, and it works for our situation right now. So I don't see myself working more in the near future.
Well, that's if it works for you, that's fine. I'm just going to
Yeah.
wonder at work. Um, as far as you said you work at a SNF,
Yes.
a skilled nursing facility.
Mhm.
What are the patients there typically? Are they orthopedic patients? Are they long term?
We get it all. We have a rehab portion. We have a full rehab hall, and we have a full rehab facility. And then we have long-term care on the other hallways. So yes, we see everything, all of it.
Yeah, I used to have to. I remember I would send patients there occasionally with they had some bad fractures or they had too many injuries they couldn't rehab at home. We put
Yep.
them for a month or so, or sometimes longer. And
Yep.
it's a good resource for the people who need it. But at the same time, I think there's I think the nutrition leaves something to be desired for sure. Um, do you? So you got the son's doing carnivore-ish, the boyfriend's doing carnivore-ish, you're doing full carnivore.
And my daughter, who is also autoimmune, is doing it as well. She
Oh,
doesn't live with me, but she's doing it as well.
and how has that been working out for her?
Good.
Yeah.
It's been working out good. Yep.
She had the same sort of issues that you do with autoimmune or something different?
I took her to the rheumatologist, and he just looked at her and looked at all of her pictures, because she took pictures of her flare-ups when they would happen, and they just didn't make any sense. And he just said, "You're weird. I can't figure you out. I don't know what you have." So
Okay.
I just said, "Brett, you got to do this. You got to do this." And she's doing it, and she's doing better. So,
Yeah.
and then my son and his girlfriend in Denver, they are also watching me and listening, and they're very open to the information that I send them. I try not to overload them, because I'm so passionate about this. I can be a little bit intense, and that's off-putting. So I have to rein it in. But I do feel like I need to save everybody, and I'm working on that.
Yeah, I've got that same affliction where I just feel compelled to try to get this information out to as many people.
Yes. Yes.
So are you on social media then? It sounds like you are.
I am. Yep. I'm most active on Instagram.
Okay. What is your particular? Do you have a handle that you use?
It's at JenBug76.
Okay. And do you? So you said if you're very aggressive about it, are you getting some negative pushback from anybody on that one?
Yes, in real life I am, and a little bit on social media here and there, but it's okay. I can handle it. It's all right. I'm not in the mood to fight with anybody about anything. I'll just keep posting my results, and it's just undeniable.
Yeah. Do you feel? Because a lot of people say, well, the only reason people get better on a carnivore diet, which also it's an elimination diet, and I'm like, well, who cares? Even if that's the case, who cares? They're still getting better. But do you feel that it's only because you cut out certain foods? Do you think meat has an additional benefit just from consuming it?
No, I feel a huge benefit from eating this way. I feel completely nourished from head to toe. My brain has never felt, I never knew what it meant to be satiated in your brain, what that would feel like. And I feel that way now. My brain is satiated, and it's happy, and it's nourished. And honestly, for the first time in my life. So I just can't sing its praises enough.
Yeah, I'm just trying to figure it, because I haven't heard that expression used where your brain is satiated. Do you feel like when you eat, you're just like, you don't have to, when you're eating a more varied diet with lots of vegetables and fruits in there, were you sort of thinking more about food? Was it more like, when's my next meal? What am I going to do? Is that what you mean by satiation, or what does that mean to you?
It's hard to explain, but when I sit down to eat, I get super excited, because I feel so good. Even with that first bite, I put my fork down, and it's just heavenly. And my son just thinks I'm crazy, because I just moan when I eat my steak, and I feel so good afterwards, and my brain feels full. I don't know how to explain it. I've tried to explain this. I want for nothing. Does that make sense?
Yeah, there's something very, I think, viscerally, primitively satisfying when you sit down and eat, a nicely cooked steak or something.
Yes.
That in there, and you just like, this is what I need. And I often laugh, because my dogs eat the same way as I do. Basically, they just eat meat, and they are so happy and dancing, and they're literally drooling, as their food's being ready. And I'm kind of the same way. I'm like, yeah, this is great. And people ask me, hey, don't you get bored of just eating steak all the time? I'm like, no, not.
No.
I mean, I look forward to it, and I have not eaten yet today, and I've got a couple more meetings to do, and I'll go run some sprints, and then I'll eat. But I can guarantee I'm gonna love that ribeye that I'm gonna cook here in a little bit. It's extremely, extremely rewarding and satisfying. So maybe
Yes.
brain satiation makes sense. Have you found that your ability to process and think and cognitively, do you think that's improved?
It's improved big time. Mm-hmm.
Yeah, that's
Yep.
I've heard that in many people as well, that they
Yep.
feel mentally sharper on that.
And
So,
I'm less reactive. I'm less reactive as well to things that normally would upset me and get me riled up.
right.
I'm
Yeah.
less reactive.
Yeah, I see that as well. People tend to be more calm, and they there's kind of this even sort of generally happy plateau, and
Yes.
it takes a lot to get
Yes.
you upset one way or the other, and so that
Mhm.
makes life a lot easier when you're not all these minor nuisances that come up. You don't really think it gets you going on that.
Right.
But you said you've been obsessed with health over the years. Are the things you have been monitoring over the years that you still continue to monitor?
Uh,
Like where somebody that measures ketones or blood pressure or sleep status, or some people are
so
biohackers.
I do wear an Aura ring every night,
Okay.
and I have for a few years now, and uh, I am sleeping better. I'm getting more REM. Um, but in the years leading up to Carnivore, I didn't really keep an eye on anything really other than just how I felt. Really, I didn't measure anything. I'm obsessed with measuring, not measuring like food or anything, but like my blood work. I'm obsessed with staying on top of that every 3 months, really.
Mhm.
So
And how about blood pressure is good, I assume? Probably.
blood pressure's great.
Yeah.
Yep.
Yeah.
Everything's good.
Yeah, if you look at like the markers for cardiovascular disease, it's blood pressure, it's inflammatory markers, it's glucose, which you mentioned has gotten significantly better.
Uh-huh.
Metabolic syndrome, obesity, which clearly you're not suffering from, and then to a lesser degree, things like some of the blood lipids have an impact, but even triglycerides tend to be perhaps more predictive, at least according to Women's Health Initiative, which is a pretty big study that they just analyzed, and they saw those risk factors. So it sounds like you're doing pretty well with this stuff here. Is there do you plan on changing your diet in any way in the near term, or
No,
okay?
nope.
And what do you feel about? You said you occasionally eat pork. What about lamb and stuff like that, or any other types of things you had in there?
I have not found a really good piece of lamb yet. I think I'm going to have to order some from White Oak Pastures or someone that, just a different, I need to try it again. But the lamb that I've had so far, I just can't get over that funk that it's got.
Yeah. Some people don't like the lamb taste. It's something.
Do you? Do you eat lamb?
I do from time to time. Yeah. In fact, I've got a rack of lamb ribs I cook out. So literally we flew in last night, and literally we dropped our suitcase up, went straight to the supermarket. I bought a bunch of steaks and a rack of lamb ribs and about, I don't know, 60 some eggs. And, that's basically our food, a little bit of cheese, and, cause I've got the whole family in here, and that's kind of the deal. So I do have some lamb. I brought my sous vide with me, which is, I kind of throw that in my suitcase. And so I can, make the food I want. And fortunately, they have a grill here, so I can just kind of, just back to normal. And it saves, the amount of money you save traveling that way is just enormous, because if I'm going out to eat this stuff, I'd be spending literally hundreds and hundreds of dollars.
Right.
So if somebody is contemplate doing this, do you have any, you said you did a lot of research before jumping. You used
Yes, I did.
Judy Cho's great. I like Judy a lot. She's got some good information out there, much of which I support and agree with.
Mhm.
Do you, when you start someone else on this, that what do you typically tell them to do? Or do you have a resource for them, or do you tell them to focus on a certain thing? How does that work?
Yep. I direct them to certain Instagram pages and profiles like yours, Dr. Paul Saladino, and all the podcasts. And I tell them just to scroll through and just start with the title that you're drawn to and just start there. And then just start listening and just start getting educated, because I could talk until I'm blue in the face, but I would rather that they, we can start talking about it, but I would rather that they just go do their own work and figure it out for themselves.
Did you do any aspirations to do competitive stuff with the bodybuilding, the fitness? And a lot of women do like bikini and
so I have competed when I turned 40. I stepped on stage and did really well, and then I did 2 shows more after that. But then, like I said, I've been in a plateau, so I'm in the best shape of my life now, like the absolute best phenomenal shape of my life. So I'm definitely going to compete, probably the end of this year.
Well, good for you. Yeah. And because you probably talk to a lot of the competitors, do you see any problems with the way they prepare? I mean, any common issues? I know a lot of women say they have gut issues or they have hormonal issues and things. Was that something that you struggle with, or you saw other competitors struggling with?
Oh yeah. A lot of women would get bloated right before they were to step on stage from whatever their coaches told them to eat real quick to get full, and they would bloat, and that would prevent them from doing well. So yeah, all the foods that you eat on a bodybuilder diet are all bloating, especially for me. And I just won't do it. I'm so lean right now, Shawn. I literally could step on stage right now. I had a photo shoot done a couple of weeks ago, and the pictures are way better than I thought they would turn out to be. I haven't done progress pictures in a while, so I didn't really know what I looked like other than just in the mirror. And that's when I really was like, okay, this diet is literally melting my body into what it's supposed to look like without me having to do anything different other than eating different. I'm still training the same way. I still train hard and intense. That's just me. That's who I am. I do things all the way, or I don't do them at all. And this way of eating has gotten me to where I wanted to be with my physique.
Yeah, that's awesome. I've seen, because I've actually worked with a number of different physique competitors, and they often say that, particularly the prep to a contest doing at Carnivore is just so much easier. They just feel better. They don't feel like the profound hunger or the profound just moodiness or tiredness they would feel with the typical bodybuilder, which would be, chicken breast and some leafy green, that's broccoli and chicken breast or whatever.
And rice.
So there's a question here from Darla asking, I guess, maybe to you, about do you utilize any sort of protein shake supplements at this point? Do you find that necessary? Yeah.
No. So I used to be on a little over $600 a month in supplements, and I'm off of everything except for the desiccated organs. But I do not supplement with protein. I do creatine. I do creatine every day, and that is it.
Yeah. I think that, given the amount of protein you're eating, I can't see where supplementing with a protein shake would benefit in any way, if you can't get enough, unless, and maybe there's some people out there that can't eat enough and they struggle to eat. They can't eat the 40-ounce tomahawk like you can, and I certainly can. But that wouldn't be normal for you. That's quite a bit of food. It's 2.5 pounds of meat in one sitting. What tempted you to do that, by the way, just to eat the 40-ounce tomahawk? What was that about?
I was on a girls' trip and I was starving because I didn't have all my normal food with me. I didn't bring enough, and we went to Ruth's Chris, and I saw that on the menu, and it was so beautiful, and I just had to order it and just try it, and I downed virtually the whole thing. Maybe a few ounces were left on the bone.
What did the girls that were with you say? I think you're crazy.
There's a whole post on my Instagram about it. It's awesome. It's showing me downing it and everything. And everyone in the restaurant was just like, watching me. And I'm like, you guys, this is the best thing I've ever had. It was so delicious. It wasn't grass fed, of course, but it was so stinking good. And I wanted to see if I could do it. I was really hungry that day, like really, really hungry. So.
Yeah, that's great. That's right. I eat those quite frequently, and that's not the 40 ounce for me is like, yeah, it's no big deal. But
Really?
yeah,
Okay.
that's
It was fun.
that's great. Yeah, you probably felt pretty good afterwards
I
too.
did.
Yeah. Where so you said you had your Instagram. Are you on any other social media sources that you're on Facebook or any of those other places?
On Facebook, and pretty much everything that's on my Instagram just goes to my Facebook. So they're identical, but mostly Instagram.
Where do you plan on going for the next, like, do you have a short term, like, what do I think about? I know you said you're going to compete, but as far as, you're working, in the nursing field, just kind of part-time, do you find yourself planning on doing anything else in the near future?
No plans right now. I'm just enjoying having my life back, to be honest, and just seeing what happens. I don't know. I don't know what the future holds. I'm just feeling good and enjoying that.
Yeah, there's something to be said for that. A lot of people, uh, they're just kind of sitting in pain and misery, and they can't do it. Life is not fun when you're hurting all the time, for sure.
Yeah.
So, were you surprised when you did this diet to get the results that you got? Were you kind of skeptical, or what did you find a big?
Yeah, I was feeling hopeless, and I was like, I have nothing to lose, and I did a little bit of keto-ish dieting before going full carnivore. Still wasn't feeling good. I was eating even organic sprouted nuts because I love nuts. I really do. And so I knew that they needed to be sprouted and organic, but giving those up was the last lever that I pulled. And yeah.
Yeah, so that made a big difference. Yeah, it's surprising. I get people that will say, if you're just giving up the junk food, everything's gonna be better. But for some of these sort of recalcitrant, autoimmune type conditions, it seems like you might need to do that full elimination, and for how long it's kind of interesting. But well, anything else you want to share before, because we're getting close to running out of our time, or anything else you want to share?
I'm just so thankful that this fell into my path and it's working for me. And now I'm just trying to save everybody else. And it's kind of hard, but I love it. I want to sing its praises. I want to shout about it.
Well, keep up the good work and being an advocate. You sound like you're a great advocate for this. And like I said, I'm sure you're going to influence hundreds, if not thousands, of people over time. So this is great. Thank you for doing this.
Yeah, thank you.
Keep us updated on how you're doing. I'd like to see how you do in your contests. It'll be cool to see. And
yeah,
come back anytime. Okay.
Okay. All right. Thank you, Shawn.
Okay, guys. Thanks, everybody. We'll see you guys tomorrow. Take care, everybody. Bye-bye now.